The president tested positive for the deadly Ebola virus early Monday morning and has been rushed to the hospital. Sources say he is in critical condition, but there has not been an official statement released from the press secretary. To start off, Ebola was first discovered in history in 1976 by microbiologist Peter Pyatt after two major outbreaks of disease happened in the Democratic Republic of Congo near a river called the Ebola River in South Sudan. Initial observations caused scientists to think that this was caused by a single person traveling between both places, but it was later discovered that the two outbreaks were caused by two different virus strains, now named Ebola virus and Sudan Ebola virus. Ebola is a single-strand RNA virus that belongs to the virus family Filoviridae. This virus family is described by factors such as their rod shape, thread-like structure, varied length, and their membrane enclosed capsid. Ebola viruses can be very large, measuring up to 14,000 nanometers in length and 80 nanometers in diameter, and have a U shape. The virus is mainly transmitted from infected animals such as fruit bats, chimpanzees, and monkeys from their meat, blood, and secretions. Ebola can be spread by humans through bodily fluids like sweat, blood, saliva, urine, feces, vomit, etc. Ebola does not have the necessary components to replicate and must use the cell's ribosomes to reproduce. The exact mechanism that Ebola uses to infect a person's cell is unknown, but one known theory is that the virus replication occurs in the affected cell's cytoplasm. After the virus enters the cell, it uses an enzyme called RNA polymerase to transcribe its viral RNA strand. The ribosomes of the cell then translate the viral RNA transcript message to produce proteins. The viral genome instructs the cell to create new viral components such as enzymes and RNA. These parts then move to the cell membrane where they are produced into Ebola virus particles. The particles leave the host cell through budding. During the process of budding, a virus uses parts of the host cell membrane to make its own membrane envelope, which encloses the virus. As more virus particles leave the cell through budding, parts of the membrane are slowly used up and the cell eventually dies. In humans, Ebola infects inner tissue linings, capillaries, and white blood cells. Ebola creates a protein called Ebola viral protein 24 that blocks interferons, which signal the immune system to increase its response when there are viral infections. Cells have little defense against the virus, and the immune system is suppressed when this is blocked. Symptoms of Ebola consist of fever, fatigue, headache that progresses to vomiting, diarrhea, and unexplained bleeding, which could be external or internal. This leads to total organ failure. Currently, there is no known vaccine to prevent Ebola. However, if a person is infected with the virus, supportive care over time can increase chances of survival. Medications that maintain blood pressure are given to patients with the virus, and so are oxygen and rehydration therapy. The Ebola virus is fatal in up to 90% of cases. Reports state that a person infected with Ebola loses up to 5 liters of fluid a day from diarrhea alone, and the severe dehydration is what leads to organ failure. Keeping the body hydrated is really vital in surviving Ebola. Most patients die between day 7 to 12, and ones that survive past day 13 have a higher chance of recovery. Children under 5, elderly, and pregnant women are most susceptible to the virus. There was a major Ebola outbreak in West Africa from 2014 to 2016 caused by the Zaire strain of the virus. There were 28,600 people who had the virus and 11,325 people who died. This is a very large outbreak, and researchers concluded that there were several factors on why it was as severe as it was. Number 1, health professionals in the area did not know what the virus was fast enough because it was new to the area. Second, the government of the area was still unstable after civil war, and the health system was not efficient with very limited doctors. Number 3, many of the doctors were limited because they died to the virus. Number 4, it was hard to trace points of direct contact because the area was so densely populated. And number 5, the way burial, because of religious reasons, caused infected corpses to spread the virus throughout the cities. Some ways to prevent outbreak is to wear the proper gear when dealing with infected patients and making sure patients are isolated and monitored 21 days after exposure. Scientists are still doing research to understand why some survive the virus and some don't, and there could be many factors at play. A post-Ebola life is filled with many challenges, and it can be extremely hard to recover. Researchers believe that there are around 17,000 Ebola virus survivors to date. Survivors often talk about post-Ebola syndrome, and these include tiredness, muscle and joint pain, eye and vision problems, stomach pain, loss of appetite, weight gain, memory loss, hair loss, neck swelling, hearing problems, dry mouth, chest tightness, tingling in the hands and feet, inflammation of the testicles, inflammation of the tissue around the heart, changes in menstruation, impotence, loss of interest during sex, and difficulty falling asleep or staying asleep. Survivors also have many mental challenges after the long and painful recovery process, such as depression, anxiety, PTSD, and survivor's guilt. There have also been studies done on if the Ebola virus stays in the body. The open form infectious diseases reveal that Ebola may be found in men's semen more than 2 years after recovery from the infection. In one case, a man gave the virus to his partner about 470 days after he began having symptoms of the illness. For the first time, researchers reported that a female Ebola survivor infected 3 other family members a year after having the illness. Some new practices for Ebola survivors have been established, such as having survivors and their partners receive counseling on safe sex practices until the man's semen has tested negative twice. In addition, male survivors should be tested at least 3 months after they first get infected. If they test positive, they should be screened again every month until the test is negative 2 times in a row. Ebola survivors have a long road of challenges, but scientists can only hope that through more research, the effective cures and treatments can change the future for these survivors. Thanks so much for tuning in.